So take a look at this time lapse from the CDC over the last month. While the majority of the states have high transmission rates seen in the red right here on this map, you can see the southern states, many of them have actually decreased to moderate, the yellow that you see right there on the map. So the change has doctors questioning whether the seasons play a role in when the virus peaks. 10 Tampa Bay's Angelina Salcido spoke to experts who explain the answer is becoming clearer.
It's how most viruses work.
The respiratory viruses, they spread through droplets.
And that's what's driving the cases to rise and fall across the country. Dr. Edwin Michael has been tracking the course of the virus for over a year.
When you have warm weather, droplets will evaporate very quickly, right? And also on the surfaces, the viruses will degrade faster. So that's why respiratory infections can spread more, because they survive more during cold, dry weathers, like winters.
Doctors say changes in behavior are a factor as cases surge in the middle of the country.
It's primarily driven, I think, mostly by human behaviors. And that's what drives the seasonality.
As time goes on and we get a grip on the virus, USF Health's Dr. Tom Unash says
it's likely to turn into some sort of a seasonal infection.
Throughout the pandemic, Governor Ron DeSantis has said that this virus is seasonal, and that's why we're seeing the increases in cases and hospitalizations.
Told people months ago we would see higher prevalence because it's a seasonal virus and this is the seasonal pattern.
But doctors say not so fast.
I would disagree with what we were seeing over the last couple of years, where we haven't really seen a large seasonality. We've seen 4 really serious peaks since the start of this infection. And 2 of those peaks occurred in the summertime, and 2 of those peaks occurred in the wintertime. So I'm not sure you could really say in the initial phases of this infection that it's seasonal.
Now, Dr. Unash thinks the governor might have been early with this prediction, but now we've got almost 2 years worth of data about this virus. And based on that, the doctor believes we are making the transition from pandemic to endemic.